Thanks for tuning in to A Better World, where we aim to illustrate that today is the greatest time to be alive and show the progress we're making as a civilization. I am your host, Luis Acevedo, and in today's episode, we're going to be going over an article that I read from humanaffairs.org in one of their blog posts, and it is titled, Shifting Non-Emergency Medical Transportation to Lyft Improves Patients' Experience and Lowers Cost. Now, before we dive into the article, the reason I wanted to do this is because obviously it's showing progression, and it's showing progression in the healthcare industry, which is something that a lot of people have strong opinions about, which is understandable completely. And one of the biggest misconceptions is that if we let governments take it over and it's free, then everything will be better. But as we know, or may not know, that most socialized medicine countries typically aren't as safe when it comes to their hospitals and their treatments as compared to here. And majority of medical innovations, about like 85%, come out of the private sector in America. So basically, the private sector is driving the socialized countries to be able to afford free healthcare, essentially, even though it isn't free because the taxes are outrageous. But this article perfectly illustrates why the free market is a perfect solution to some of the issues that we see in the healthcare field. And one of those things that we have an issue with is transportation. Now, millions of Americans don't make their necessary checkups because of lack of transportation. And typically the people that are at a risk of not being able to make it are people who are usually older, chronically ill, or poor. So they just can't afford it. They can't drive and they have nobody to take them. And that's not good because these people obviously need medical attention, but without the transportation, they can't do it. But there's this system that they have in place where Medicare Advantage and Medicaid programs offer benefits of non-emergency medical transportation. So that way people who need medical attention or need to go to the doctors for whatever reason can use these non-emergency medical transportations. And in these cases, it is something like private cars, taxis, or specialized vehicles if people need it. But there's been a lot of reports of not good things happening with these non-emergency medical transportations, such as fraud and abuse, which is just downright cruel if you ask me, because you're hurting the people who need the most attention and need the most help. You're taking advantage of them. That's wrong. And just poor customer service all in all. So what they have done in this part of the medical field is try to start up a transportation network of companies that will replace some of these private dispatchers who have a bad reputation amongst the patients. So, for example, Lyft is one of these companies that are involved, and they've also started, not Lyft, but there's also been other startups made specifically for this, like Circulation and Road Trip are specifically ride providers for people who need medical attention or just need to go see, a doctor for a regular checkup, and they don't have transportation. So there's companies starting for it, and Lyft is actually become partners with a fairly new company called CareMore, and also partnering up. CareMore is partnered up with a broker for the NEMTs, which is short for non-emergency medical transportation. That's what we'll be using for the rest of this episode because it's a mouthful to say the other thing. So, for NEMT, American Logistics Corporation is the broker that CareMore goes through. And CareMore is a company dedicated to providing deliveries, to making sure the delivery system for healthcare is run effectively. So Lyft and CareMore launched a pilot program back in 2006. And this pilot program, for the short amount of time that they had it, there was 479 rides. And in that 479 rides, the data shows that the wait times went down by 30%, and it also reduced the cost of the transportation by 32%. And the reason for this, the latter part of it, is because CareMore provides these NEMTs free of service. And also, they do provide curb to curb, which is essentially just your normal, where you and I call a Lyft or an Uber, and that's who will be picking us up. Just a regular car. We get in, they go, they drop us off. And then they even have specialized vehicles, which is called, I believe, door to door, which if you need, handicap accessible vehicles, and that's what they'll provide you with. So this program, with the success it had, has actually continued. And what they do now, as far as 2017, after they had more than 7,000 rides per month, totaling of 68,993 rides in 2017 entirely, what they have found was a 91% drop in wait time. And, that was inaccurate. They saw a 91% increase in customer satisfaction, it looks like. And the average wait time for a Lyft driver to come get you, as opposed to a non-Lyft driver who was another NEMT, it took 9.2 minutes, but for the non-Lyft driver, it took 16.6 minutes. So almost half. So that dropped it by 45% in total. And now, CareMore, an American logistics corporation, they've come together to make an app. It's called MyRide, and this app allows for patients, their caregivers, or whoever's taking care of them to track and manage the ride services that they get to the hospital. And the process they go through is, in my opinion, it seems to be a little excessive. Maybe there's better ways to do it. Maybe there isn't. I don't know too much about the industry, but from the process, as I'm about to go through, it just seems a little excessive. So basically what happens is the patient is going to call CareMore, tell them, that they need a ride, and then CareMore is going to take down their information, and then they go ahead and call ALC, American Logistics Corporation, and then ALC uses a special, unique software to essentially schedule the Lyft driver to come pick them up. And then CareMore will then call the customer back or patient back and say, hey, the Lyft driver is going to be here at this time, so that way they know. But overall, this program has saved money, has saved wait time, and is also providing people, the dispossessed really, with an opportunity to go get the medical attention they need and get there free of charge, which is a beautiful thing. And that just goes to show right here that once we put some good free market innovation into play, we actually get beautiful things happening. And we're actually able to reduce the cost because we're trying to be creative in how we do things, as opposed to if it is all run by taxpayer dollars, there's no need for creativity because they're going to get paid regardless. They don't need to please anybody because it's coming out of our checks before we even see it. Whereas this, it's an option. You don't have to go through it if you don't want to, but it provides you with more opportunities to seek the medical attention that you need. Now, obviously, this is just a small, well, not really, because it's helping millions of people, but it's a smaller scale as to what most people are concerned about with the healthcare. And the healthcare that people are concerned about, their actual healthcare, not the transportation to get there, which I guess is understandable because there's more people who are dispossessed by the healthcare than the transportation to get there. But still, nonetheless, this is progress in the right direction to help people who need it and also provide them a service free of charge in the free market without having to spend taxpayer dollars and hoping the government will do the right thing. I tend to trust people to do the right thing more than I do the government. And that's because we are built on a system of trust, and we don't want a bad reputation. The government doesn't really matter if they have a good or bad reputation because they're going to get your money regardless. Whereas if you open up a business, you have to cultivate a good environment and make sure that your reputation is good, so that way you stay in business and you're providing your customers or patients with excellent service, all in all. So this right here, I think, is a beautiful thing, and I think that it's a segue for improvements across all domains in the healthcare world. So I hope you guys enjoyed the show. Hope you got something out of it. And like always, if you like what you saw or heard, please subscribe and pass it along to a friend. And if you have any feedback or a recommendation on a topic you would like me to do, please let me know, and I'll be more than happy to do that, as long as it is showing that there has been improvements made. So you guys have a wonderful day. Peace.